Now that we've established this baseline and this basic understanding of one single wave, when we're looking at a normal sinus rhythm and what that entails, we need to break it down into what exactly the word is. We know normal, sinus, and we know rhythm. Normal means that the heart is beating at a normal rate. Whenever you're looking at EKG, always think about those 5 factors. Is it normal? Is the rate normal? Is the rhythm regular? And then is the QRS, do we have all the waves? And each waves, are they preceded by the prospective waves? Normally, if you want to look at a better picture of the heart, we have to order what we call a 12 lead EKG. But from the monitor, when you monitoring the patient's vital signs, what we see is a 6-second strip. Within that 6 seconds, how fast is the heart going and what is going on in the heart within that 6 seconds? This is what the strip represents. So first of all, we're going to determine if this is normal, right? Because we're talking about normal, we're talking about sinus, and we're talking about rhythm. Does this look normal to you? Is there a P wave that preceded each QRS complex? I know I have a P wave here, and I know I have a QRS complex here. I know, and I have a T wave. Each of these spikes and each of those waves are preceded by their respective wave. Because I can identify that, I can say that this is a normal EKG. It's normal sinus. Now, I'm not saying it's a normal sinus rhythm, right? Because I don't know what the rhythm is just yet. In order for you to determine the rhythm, you have to count each of those spikes. Each of those spikes in that 6-second strips represent how fast the heart is beating. And obviously you multiply by 10. Let's count it. Each R wave, QRS, R, 1R, 2R, 3R, 4R, 5R, 6R, 7R, 8R. And that 6-second strip, we have 8 spikes. And if I multiply this by 10, I can speculate that my heart rate is around these. And this is what determines a normal sinus rhythm. It's normal because I have each of the waves looks normal. Nothing is bigger than the other. It's sinus because each waves are preceded by their respective waves. And it's a normal rhythm because I can count it and it's 80. It's within that 60 to 100 beats per minute. Therefore, that makes it normal. Now, anything that deviates from that is where we start getting those pathological strips.